is there still a case for the current structure of split responsibilities between the CQC and monitor?
We focus very much on what are we trying to achieve for the patient. We felt that trying to think about where we are now wasn't necessarily where we would have been if we'd started from the point of view of what we wanted for the patient. We felt that there was definitely a case for bringing together the professional regulation, system regulation and financial regulation, for want of a better word, together and finding a way of making sure that they're consistent, but that we didn't necessarily feel that that meant there had to be one regulator. While that might be an ideal situation, there was a concern around the table that trying to bring the regulators together would actually cause more chaos than it was worth.
More structural
absolutely, too much change, and actually a long period where there would just be too much chaos. We talked about focusing on care pathways rather than providers in the same way as many other people in the room have. And we were also talking about what needed to be in place in order to deliver. And the key thing that people felt needed to be in place was ownership locally, not just amongst managers, but also amongst clinicians and people working together, focusing very much, again, on what made things better for the patient. And the regulators being there to assure that those processes were in place, rather than necessarily being there to actually do the improvements for patients.
Yeah, I mean, it's interesting, your plea for no structural disruption. There's a point that Peter was going to make, I think got a bit lost at the end of his presentation, about leadership of regulators, that good leadership can overcome a poor structure. Are there changes that people would like to see in the way that the regulators behave?
Thank you very much. It was only to say, in terms of behaviour, I think there's something about speed, which was the point I wanted to make before, that if there were ever a problem like BidSNAF detected by whatever regulator in the system, that they should be capable of moving with speed and in a coordinated fashion. If it is with another regulator, that they talk together but move with pace. I think it would be unfortunate if there were another issue where people were arguing, pardon my French, arguing the toss about who could do what when and the evidence base that they needed before they could intervene. I think patients would expect timely and swift regulation, even if it were only a temporary measure. There's something about that and how they behave.
Well, I think there is a challenge for all regulators, and if people will remember that there was a thing called the Concordat, which was an attempt to try and get regulators, which well, I haven't written the history of that period, but my guess is that most people would conclude it didn't quite work. So I think we've got to learn the lessons of that in the past. And if we're not going to have massive structural reorganisation, and there may be structural changes you could make, for example, within professional regulation, but if you're not going to have massive structural reorganisation, the challenge, therefore, is how does professional regulation work alongside its new sister, as it were, in system regulation in ways that has not satisfactorily been done before. And part of that, I think, is that professional regulation historically has been about intermittent and catastrophic intervention in the system. In other words, when something terrible goes wrong, rather than an ongoing engagement with the system. And I think that is the challenge for professional regulation going forward, that it will have to develop a closer and more ongoing and in some ways supportive relationship with the system that it regulates. And that also means not living in a silo, but recognizing that professionals work in teams and institutions, and therefore they're not simply dealing with a bunch of individuals who are simply operating on their own.